say, by March, and it says if the current projection is 6,724, if there's universal masking, there would be 5,800. You're taking these steps now, and yet we're getting a flurry of responses from the other side of the aisle. Cal Barr saying you don't know what you're doing. Senator Pratt saying that if the governor has evidence that the last lockdown actually worked, that there's hard evidence, show it. We're just getting a flurry of criticism on this move. How do you respond to that? And as a corollary to that, do you worry about losing 2 DFL members of the Senate? They're going to the independent column, but does that in any way worry you about what this might mean for the legislative response going forward?
No, that's the last thing I worry about. The legislators can make up their own mind. What I would say about this, Kevin, is that these are folks from the beginning that did not believe the science around this virus. It is very clear with the rates by states surrounding us, even with much smaller populations and without a large metropolitan area with the density that we saw, we had much better results, and that's proving out now that these are the folks that were saying, but your death rates are higher. They're much lower now than their surrounding states, the hospitalization rates, but they brought it here. And these are folks that, again, gathered together en masse, found the need to just go on as business as usual. So my response to that is I'm willing to work and want to work with anybody. There is not a single, if you can give it to me, if those senators show it, there's not a single person in the medical community in the state of Minnesota that agrees with their assessment. I'll deal with the side that falls out there. My first concern is to follow the science, the data, and the evidence. And there's a reason that every other nation and many states that are starting to move are seeing this data, using it, and putting in very similar restrictions.
Just very quickly, if I can follow up, perhaps for Commissioner Malcolm, are those projections the same ones that you're operating with, or do you have more optimistic projections for, say, by March? Are we going to have potentially fewer than 6,700 deaths? Do you hope for that? Do you expect that?
This is Commissioner Malcolm. We always hope for and work for preventing as many preventable deaths as we possibly can. I assume you're talking about projections from IHME.
Exactly.
There are many different models out there. Theirs has, I think, gotten more accurate as time has gone along. We are optimistic that with the improvements in care that we've seen, and if Minnesotans support these moves, that we absolutely aim to prevent every avoidable death that we can and to beat these numbers.
Thank you.
Next question comes from the line of Jeremy Olson from the Star Tribune. Your line is now open. Jeremy Olson from the Star Tribune, your line is now open.
I'll shoot Jeremy a note. Let's go ahead and go to the next reporter.
Next question comes from the line of Tom Hauser from KSTP TV. Your line is now open.
Good evening, Governor. 23 days ago on October 26th, on a Minnesota Department of Health call, I asked you specifically about reports your administration was planning significant restrictions or shutdowns of bars, restaurants, fall and winter sports in mid-November, and you said, quote, none of that is correct and none of that has been discussed. Did none of your health experts see this coming even 3 weeks ago so that maybe Minnesotans could have been a little more prepared for what was coming instead of having it sprung on them 2 days before they go into effect?
Well, it's not a spring on, Tom, and the fact of the matter is that no one in the medical community, and I would, put you onto that. I think you should probably call all of those healthcare systems in Minnesota. No, the answer was, and I showed a slide tonight, there was significant difference. And we don't rely just on our internal data. We're relying on our partners in the healthcare system, where they're at as far as beds and staffing. And at that point in time, there wasn't an intention to try and move, because our goal has always been to try and walk that line between protection of public health and making sure that those activities that people want to do. On the 26th of October, as I said, Minnesota was down about in the middle of the pack on infection rate. I don't think anybody today, of all the nations in the world, North Dakota counts as the worst nation in the world for infections, and so does South Dakota. None of those things were true on the 26th of October. So we move where the data moves, and as we said, it is moving under our feet very quickly. That includes the healthcare systems and and we look at many independent projections, and most of them were not predicting that type peak. We knew, and I've been talking about it for a long time, the potential was certainly there. But no, this moves very quickly. We start to try and gather that data as quickly as we can. We have been having conversations every single day about how we approach this and mitigation measures. But when you asked me the question on that day, there had not been a deep discussion around measures that would involve a dial back.
As a quick follow-up, do you have a specific plan beyond asking the federal government for help to give financial aid to the thousands of Minnesotans who are likely to lose their jobs again just before the Christmas holiday season?
Yeah, it's very difficult. States cannot run deficits, as everyone knows. The federal government has grossly failed in their responsibility. I've been talking to our members of Congress, our senators, and our members of the House that here in Minnesota, we put out $10 million last week in aid, especially targeted at those small businesses. We will come back collectively together, but again, as you well know, it's the legislature that appropriates, not the executive branch. I would hope that some thought is being made around that, but we certainly know that needs to be there. All 49 other governors are saying the exact same thing, that they don't have the capacity in the state. We do know that the state of Minnesota gave more of our CARES money to our counties and cities than any other state, and cities like I saw in Minneapolis is starting to put some of that out. So our intention is to continue to work on it, but let's be very clear. This is the federal government's major responsibility. They have failed at it, and I don't care whether it's the current administration or the incoming new administration. Congress needs to figure out how to make sure that that aid gets there. And I would settle for a scaled-down package that targets small employers and workers, specifically around the closures in the hospitality industry, and that's what I'm asking for.
If Steve Grove could just chime in on, is there money available for unemployment for these people who are going to be contacting you soon, then I'll hang up and listen. Thank you.
Hi, Tom. Yes, this is Steve, and there is money available in our unemployment insurance system. It is, of course, borrowing from the federal government at this point, like almost every state in the nation, but we are ready to take on any influx of applications we get as a result of this 4-week pause. And, I think the challenge is that, to the governor's point, the additional benefits that were there from the federal government earlier on in the pandemic, that $600 top-off, the extended unemployment insurance for an additional 13 weeks, the unemployment insurance for independent contractors and the like.
Thanks for sticking with us. You are listening to Governor Walz answer questions about the state's new COVID-19 restrictions. Switch over to Fox 9 Plus at 7 to hear the rest of this press conference.
We'll join you there. Up next here on Fox 9 is The Masked Singer. Thanks for joining us. We'll see you in 60 seconds over on Fox 9 Plus with the remainder of the governor's news conference.
Thank you so much for joining us here on 7 Fox 9 Plus. We are following some breaking news coverage regarding some dial-back measures that will take place soon here statewide. The Governor Tim Walz, taking questions now from the media to talk about what will happen here and unfold in the next couple of days.
In fact, let's join in that news conference now with questions from the Capitol Press Corps.
Amount of time not modeling the spread and potential, trajectory. They were modeling the impact on their own workforce, the healthcare workforce. And that is something that had not been done before, and most of the healthcare systems had not been seeing that type of granular data around it. So I think it was a combination of starting to see that sense of urgency, and you'll see it in the statements of many of our healthcare folks that that's happening across the country, ratcheted up very quickly.
And if I could just follow up too, maybe this is a question better for Commissioner Malcolm. How did you guys land on this 1 month period? And how will you know it's okay to dial ahead, I guess, I'm not sure what the right terminology is, on December 18th? Like, what do you need to see for things to start to reopen again then?
Governor, would you like me to take that one?
Yeah, go ahead, Jan. I think, it's a great question on the metrics, and please go right ahead.
Yep, thank you. Well, just to also build on the governor's last point about what changed so suddenly, I mean, we've had an 80% increase in hospital admissions in the last 2 weeks, and a daily average of 220 admissions each day just last week. So as the governor said, things really did move quickly between last week and this week. So the reason for 4 weeks is two incubation cycles, or two generations of potential transmission. We've learned over these months that it's good to give a full 4 weeks to measure the impact of something. And as the governor has reinforced many times, what's going to happen in the next couple of weeks is already the die are cast, so to speak. I mean, these cases are already in the pipeline. People have already been infected. The current cases are going to end up in the hospital, a percentage of them. So we know that things are going to get worse for the next couple of weeks. The hope for positive impact of these moves should show up in the 3 and 4 week time frame. So we're going to hope to see our admission rates stabilize and come down, our case growth on how many new cases do we have per day per 100,000 people. That's a critical metric that we compare ourselves to others, and that's the measure on which the governor said we were in pretty good shape 2 weeks ago, and now we're in the top 10 rapid case growth states on that metric. So we want to see the average cases per day per population come down. We want to see our percent of tests coming back positive come down. We're at 15.3% now, test positivity. We've been that high before, last April, but back then we were testing literally a tenth of the people that we're testing now. So the fact that we're testing so many people and still finding this degree of increasing test positivity is another one of those signals. So if test positivity stabilizes and starts dropping, that will be a very good sign.
Okay, thank you.
Your next question comes from the line of Chris Larson from Flag Family Media. Your line is now open.
Thanks, Governor Walz, for taking time with us this evening. My question is for you and for Commissioner Grove. Small businesses of Minnesota, they're in dire straits right now. The additional restrictions announced today will mean more of them will go out of business. One, Governor, your reaction to that thought, and two, for both you and Commissioner Grove, what is the plan of the state government to help them from hopefully keeping from going out of business?
Yeah, and thank you for the question, Chris. As I said, this issue around small businesses absolutely pains me. I think we need to be clear with the rates of infection we have. There's not going to be people to go to the restaurants. There's not going to be people to go. And what we do know is whether there's restrictions or not, once you reach a case positivity rate in states like this, there's virtually no difference because people aren't going anyway. So what I know is, and what I've been saying, when we're asking these people to make these changes to protect their neighbors, to protect the hospitals, this false narrative that was started by the federal government in many cases that did not have a plan and just pushed it back on the states, this is not a choice between the economy and the health. There's no economy to go back to if we don't get a handle on where this is headed. And so what I've been saying is that these folks are being heroic, doing what's asked of them. Every other nation on earth provided their businesses the support necessary to make the right choices, and they got a handle on it. And guess what? They've lost less people, the businesses are working again, and their economy is coming back. Unlike here, where we're mired in this and has continued to go on, that has made it incredibly challenging. So my heart breaks for them. As I said tonight, it is grossly unfair of what's happening to them, because these are the businesses where COVID spreads the most. And we have done, whether it was moving CARES Act money, whether it was helping support and get the first stimulus bill through, but now every single economist and every single governor is saying the only way you get through this thing and the only way you stop the spread is by giving small businesses the help that they need right now so that folks can stay home. So, Steve, you want to take it?
Yeah, Governor, I think that's exactly right. I'll just echo that. I mean, we have been on calls with business leaders all day today, of course, and really every day of the last several months on these topics, and we know how devastating today's news is in the short term, and it is clear that you're right. There are businesses that won't make it through the end of the year, and that's a devastating thing, and consumer confidence is at all-time lows, and we need to have the workers and the demand there to sustain our economy. But I think one thing that's important to understand, and the governor mentioned these economic models, when you look at what the IHS market report has showed to us in terms of long-term job growth for our state, they put out a couple different scenarios. One is a baseline assumption where, a vaccine comes and we continue to mitigate the virus, which has us gaining back a lot of our jobs by the end of 2022, the jobs that we lost since the pandemic began. But if unmitigated spread continues and you have a major rise in cases and crumbling consumer confidence, that projection of job recovery goes out a full year beyond that, well into 2023. And so, obviously the core component of this move today is to protect our public health, but there's a long-term economic recovery component to this that's really essential. And, in the short term, we need Washington to act. We're going to continue to get all the state assistance we can out the door, but it's limited, and that federal help is just going to be really essential.
Thank you.
Next question comes from the line of Dave Arick from Pioneer Press. Your line is now open.
Thank you. I've got a couple of clarifications on some of these things. Construction projects like in the home, ongoing renovations, things like that, self-interest, I happen to have one going on right now. Can that continue?
This is Steve. Yeah, the construction and manufacturing and those industries can continue. Of course, masking up and staying socially distant is critical, but those industries were not affected by today's order.
Okay, thanks. As far as enforcement on these social gatherings, Governor, do you acknowledge that this is essentially one that is largely unenforceable, but you're just sort of pleading for compliance with?
Yeah, I'm not afraid to say that, Dave, that I ask Minnesotans, I need them to protect their neighbors. The facts are there. I mean, I'm still stunned when the response in the first few minutes, as one of the earlier questions asked, that we've got legislators who simply refuse to believe this. And that's what tells people they didn't need to wear a mask. They don't need to do this. I'm just begging people and asking for them that we know what works. We know we can make a difference. And I think a lot of people simply, and part of this is just to inform them. So what can I do? What's really risky? We have got to get to the point on public health that it is so grossly irresponsible for people in positions of authority to put out verifiably false information about what the science says around controlling a pandemic. And what I'm trying to do is to give them good information, to make sure that they know this is real, this is what you can do, this is what will be able to help. But yeah, as I've said, I'm not going into someone's house on Thanksgiving, but here's the thing. If you're gathering with a whole bunch of people not in your family on Thanksgiving, you're really speaking volumes about what the values are here in Minnesota. And I know it's hard. It's hard for me. So I once again am just asking people that we know this works, we know it can make a difference, and we need to do it.
Thank you. And last question, what is the rationale for not closing pro and college sports, but shutting down all the other sports?
Yes, Steve, do you want to take that? Because of, again, there's a great inequity here, and I get that. And some of that inequity is like so many of these things, it comes with money and what they're able to do. But Steve, you want to take that?
Sure. Yeah, it's a great question. Professional sports are workplaces. We sometimes forget that. They're not just entertainment venues and places to congregate, but the athletes and the professionals there are our workers. And so while fans are not allowed in professional sports, as we've discussed, the games themselves can continue to play. College is under the jurisdiction of those governing bodies, and so, but again, you see no fans that will be congregating for those games too. So it's tough because these are the things that we love to watch and partake in, but they're just very different in this COVID world.
I'm sorry, I didn't hear you explain. Is the spread not as risky in both of those venues, universally?
Steve, it's more contained is what the situation is. They're testing every single person. As I said about the inequity of this, we're not testing every single high school athlete, and we're not, basically keeping them in a pod close together. We're not keeping the coaches all working together, testing 2 or 3 times a day. And so the ability to control this and the mitigation efforts that they put in place are vastly different.
Thanks.
Next question comes from the line of Dennis Biwak from Care 11 Television. Your line is now open.
Governor, one of the most common questions we're getting from people, whether it's restaurants and bars, high school sports, gyms, they're looking at the number of cases connected to the outbreaks. They're seeing, for example, 780 cases with sports. When you look at the more than 200,000 cases statewide since this began, people seem to not be grasping why exactly you're targeting certain industries or looking at those industries for the restrictions. Can you just walk us through that process of why you chose these specific types of gathering spots and sports, gyms, restaurants, weddings to make the decision for these newest restrictions?
Yeah, I'll let Jan do it in a bit more detail. I just want to be clear when you're reading those numbers. For every one of those 780, the second and third effect infections that will happen equal about 70. So you can take the 780 times 70 to get to where those are coming from. These are also known infection rates. Granted, we are now at a point because of widespread community spread that many of them are coming from unknown sources. That doesn't mean they're not coming from some of these, but what we know is, and the reason we're focusing on these, is we do know that the predictability of the activity is leading to more of those cases. So these are activities and these are places because of the amount of exposure, the nearness to the exposure, the unmasked and the time that you're unmasked. Those are the places where it's happening more. And so the case numbers, and Jan, you could explain that in a little more detail, while it appears like that's a very tiny number, it's not a very tiny number, and it has had an impact on how much of this spread. And then think about that. Each one of those 70 that came out of each one of those 780 spread it to someone else that might be considered a community spread, but this is where we're seeing it.
Governor, that was great. There's not much I need to add to that. And that is the problem with just focusing on the numbers. And I'll also say that these are just, as the governor said, the primary cases, the first case that we can attribute with some certainty to a specific setting. And when we count something as associated with an outbreak, there's a certain threshold. We don't even start counting until there are a certain number of cases from different households associated with these different settings. So those numbers are, to begin with, a very significant undercount. And then, as the governor, I think, did a good job of explaining, it's not only that primary case, it's who the primary case spreads to, and then they spread, and then they spread. And I think that's something that in the modern day we've maybe lost a little bit of track of how a pandemic works and what it means when you get to exponential growth, when one person spreads it to 3 and those 3 spread to 3, and that's how you get to a multiplier of 70 by the 4th generation of transmission. And we're well on our way to that right now. So we could do the math on any of these settings, and that's what we would expect to see over time.
Just my one follow-up is, I know early on in the pandemic with the stay-at-home order, there was some modeling that showed exactly how much contact would be limited based on the mitigation efforts. I guess, does the health department have any data that shows that if we take these steps, it'll reduce social contacts by X percentage?
We are, I think you're referring to the model that the University of Minnesota developed with our health department, and they've continued to work on that. We don't have any new projections to share because it's actually not a projection type of model. It's really meant more for simulations of impact of different things. But an earlier question asked about the IHME model, and they did share with the governor just a little bit earlier some of their projections of what difference mask wearing at as close to universal mask wearing as we could get, and the difference that would make in our the daily number of cases. I mean, and the IHME model shows that unmitigated, if we just kind of continue on as we are with no further mitigations, we could expect to hit 20,000 cases a day by early in the new year, around January. Whereas if we can really implement all of these measures and achieve a big reduction in contacts and closer to universal mask wearing, we could drop that number down below 5,000 cases a day. And I'll just say, about 2 weeks ago, I thought a 5,000 case day was horrific, and now that looks like a good day. So that's kind of, again, how quickly things have moved.
Operator, we have time for just one more question today.
Next question comes from the line of Courtney Godfrey from Fox 9. Your line is now open.
Quick question, because I didn't hear this from the NPR question, which was along the same lines. Should Minnesotans expect that at the end of this 4 weeks we will revert to where we are now, or will we see a phasing in like we did last time?
Well, thank you for the question. The data will drive our decision on that. And as I said, with my hope is, and I know it's a little bit, I think it's okay to dream a little bit here. I think there's the potential by the time we get to the end of this 4 weeks that we're into a vaccination protocol that is starting to happen. That will start to impact that. We'll see what kind of impact that we've made by these changes. And just to be very clear, these changes will not have any impact whatsoever if Minnesotans don't do them. And I think that question kind of got asked earlier. We need them to do it. So those who said you've tried this before and it didn't work, my favorite was the people who don't wear masks and say your mask mandate didn't work. No, it didn't work as maybe as well as it could have if we would have got 95% instead of 65% compliance. So we'll take a look then. As the commissioner said, it's 2 incubation periods, if you will, and our data now after 8 months shows if we're going to see some of this impact, which we did all along. There's a reason that we were at 5%. The Dakotas were at 30%, and Wisconsin was at 30%, and Iowa was at 30% before us because we were making those measures. And so now we'll get to see if that happens.
Commissioner Malcolm, really quick, do you have numbers? How many cases exactly have been linked to restaurants and how many have been linked to sports?
Well, yeah, in terms of what we were talking about the method here, depending upon how you attribute to a specific outbreak, the most current data, and it is data that's about a week old in the case of bars and restaurants. I think what meets our outbreak threshold, which is 5 cases from 5 different households. It's about 3,600 cases from bars and restaurants. And the sports data, I'm just going to try to pull that up. This is a little bit older data. Looks like just about 7,200 cases attributed to sports. And I just would make the point on the sports numbers, those are, again, primary cases only and only associated with the actual sports event itself. But one other thing we know about the sports cases is it's not only the game or the practice, it's the social activities that tend to accompany that. So the true picture of what sports are contributing, if you will, to the spread is not just the games itself, but the activities that tend to go around those gatherings.
Well, thank you all. I'd like to make just 2 final comments. Earlier this week, I was talking to that emergency room physician in West Central Minnesota, and I think the implications, and those who say we should just do nothing, what it meant is at the point where we're at now, even though the mitigations that we're taking before tonight, this emergency room physician said she had a patient came in, checked in, And while they're waiting in the emergency room, they had a heart attack because they had to wait 9 hours because of the COVID cases that were ahead of them, overrunning that hospital. And for those who say that this is just going to run its course, I, as governor of Minnesota, refuse to have a situation that looks like El Paso, Texas. Today, there were 175 families lining the streets outside of freezer trucks because there's 175 bodies in there with no place else to go. This is the end game of this. It is not debatable. It is not, maybe we'll get lucky. If you don't do these mitigations and you do not put in the things necessary, both to protect the workforce in those hospitals, their PPE, their bed space, or whatever, you are going to end up with a situation where we have to ethically triage who gets care and who doesn't. You will have people in the hallways, like you saw already starting in Minnesota with this gentleman who couldn't get in time to have the care that he needed. And so I understand very clearly the restrictions, and I understand the pain, especially around youth sports. But I'm not going to play another 8th grade football game at the risk of a gentleman dies from a heart attack because we didn't do what we could do to reduce the numbers of folks flooding that room. This data is out there. The United States has done this as poorly, as I continue to say, as any nation on earth. There are models out there that work, and these mitigation efforts, if Minnesotans do them, will give us a fighting chance to get to the virus and get on the other side of this. So I want to thank you all, and have a good evening.
Thanks so much for being with us. You've been listening
listening
to the governor, Governor Tim Walz. Take questions about new restrictions that are set to go in place soon. Restrictions that are said to hopefully slow the spread of COVID-19. This is a 4-week pause impacting gyms, restaurants, bars, youth sports, as you just heard, also put on hold. The governor saying that right now, hospitals, they are overwhelmed as cases